All right, let's talk about an injury that pretty much every athlete, from the pros to the weekend warriors, worries about: the dreaded sports elbow. You know, whether you're swinging a tennis racket, a golf club, or honestly just lifting something heavy, that little joint in your arm takes a massive beating. So we're going to get into it.
Summer is in full swing, right? That means tennis, golf, baseball, you name it. And with that, we're seeing a huge spike in elbow injuries. So you've got to ask yourself before you head out to play, is my elbow actually ready for this? Because trust me, nothing tanks your summer plans faster than that sharp, nagging pain.
So, to help you stay in the game, here's what we're going to cover. First, we'll do a quick tour of the elbow itself. Then, we'll get into the two main ways it gets hurt and introduce you to the usual suspects, aka the most common injuries. After that, we'll walk through the path to healing, how to prevent problems in the first place, and wrap up with that all-important question: when is it really safe to play again?
Okay, first things first, we've got to get familiar with the anatomy. You know, understanding how your elbow is built is really the key to figuring out why it's so easy to injure. It's a total marvel of engineering, but all that complexity, well, that's also its biggest weakness.
So, your elbow has this fascinating dual personality. On one hand, it's a simple hinge joint, just like on a door, letting you bend and straighten your arm. But here's the cool part. It's also a pivot joint. That's what lets you twist your forearm, you know, like when you're turning a doorknob. This 1-2 punch is what makes our arms so incredibly versatile.
So what's holding this whole thing together? Well, you've got 3 different bones all meeting in one spot. They're held tight by these super strong ligaments on the inside and the outside. And then you've got all the muscles and tendons that cross over the joint, the ones that actually control your wrist and fingers. It's this whole intricate network that has to absorb all the force from everything we do.
With all those moving parts, it kind of makes sense that there are two main ways things can go wrong. We can pretty much sort every elbow injury into one of two buckets: the sudden ones and the sneaky ones.
So on one side, you've got your traumatic injuries, the sudden ones. This is the stuff that happens in a split second. A fall on an outstretched arm, a direct hit, you get the picture. We're talking fractures, dislocations. But on the other side, you've got the overuse injuries, the sneaky ones. These creep up on you. They're caused by doing the same motion again and again and again, which just slowly wears down the tendons. This is where most sports injuries live.
Okay, so what do these injuries actually look and feel like? Let's meet the most common culprits, the ones that send athletes of all levels running to the doctor.
All right, here are the two big ones, the most famous elbow problems out there. And the key difference is super simple. It's all about location. Tennis elbow gives you pain on the outside of your elbow. It messes with the tendons you use to bend your wrist back. Golfer's elbow is its mirror image, pain on the inside of the elbow, from the tendons that bend your wrist forward. Here's a quick test. If turning a doorknob hurts like crazy, it could be tennis elbow.
And, don't let the name fool you. Tennis elbow is incredibly common in so many sports. In fact, get this. Research shows that more than half of all athletes who use any kind of overhead arm motion will get it at some point. That number is just staggering.
Now, for anybody who throws a ball, baseball players, quarterbacks, the ulnar collateral ligament, or UCL, is the big one to worry about. Every single time a pitcher throws, this massive force called valgus stress yanks on this ligament. It's basically a force pushing the elbow inward. Over time, that can stretch it out, cause inflammation, or even a complete tear. And that often leads to the famous Tommy John surgery.
And finally, we've got to talk about dislocations. You might be surprised to hear just how common these are. This quote says it all. They're the second most common major joint dislocation in adults. It's when the bones are literally forced out of place, usually from falling on a straight arm. It is incredibly painful and a definite trip to the emergency room.
Okay, so you've got elbow pain. Now what? Let's walk through the path to getting better, from figuring out exactly what's wrong to understanding your options for treatment.
The process is actually pretty methodical. First, your doctor's just going to talk to you. Get your story, what are your symptoms, what were you doing when it started hurting? Next up is a physical exam. They'll move your arm around, test your strength and stability. If you're a thrower, they'll likely do that valgus stress test to check on your UCL. And if they need a closer look, imaging like an X-ray or an MRI can show them exactly what's going on inside.
Now here's some really, really good news. The overwhelming majority of elbow injuries get better without surgery. For tennis elbow, we're talking over 90% of cases are fixed with more conservative treatments. That just goes to show you how effective good old-fashioned rest and rehab can be.
So think of treatment like a ladder. You almost always start on the bottom rung with conservative care. Rest, ice, physical therapy, maybe a brace. If that's not cutting it, your doctor might suggest moving up to injections, like platelet-rich plasma or PRP, to try and kickstart the healing. And way at the top, as the last resort, is surgery. That's for the really severe stuff that just won't heal any other way.
Of course, the best treatment is to not get injured in the first place, right? So let's shift gears and focus on what you can do to build a stronger, more resilient elbow and seriously lower your risk of getting hurt.
Now, this stuff might seem basic, but I'm telling you, it's the stuff people always skip. A proper warm-up gets blood flowing and wakes up your muscles. Good technique is absolutely crucial. Sometimes working with a coach can fix a tiny flaw in your form that's putting tons of stress on your elbow. And remember, to strengthen the whole kinetic chain, your shoulder, your forearm, your wrist. But honestly, the most important thing, listen to your body. Pain is a signal to stop. Rest is when you actually get stronger.
And here are a few super simple exercises you can do anywhere to build up that support system. Squeezing a stress ball builds your grip strength. The simple wrist turn improves your rotational control. And the towel twist, that is a fantastic exercise for all those little forearm muscles that keep your elbows stable. These small moves can make a huge difference. And that brings us to the final, and maybe the most critical question every injured athlete has to face. When is it actually safe to get back in the game? And let me tell you, it's way more complicated than just waiting for the pain to go away.
To help with this really tough call, sports medicine experts have developed these amazing frameworks, like this one, the decision-based return-to-play model. It's not just a simple checklist. It's a whole process for thinking through all the different factors so you can make a smart and, more importantly, a safe choice.
So, the model breaks it all down into 3 steps. First, you evaluate your health. Has the tissue actually healed? Is your strength back to normal? And are you mentally ready to go back out there? Second, you have to evaluate the risk of your sport. The risk for a swimmer is totally different than the risk for a linebacker. And finally, you modify the decision based on the situation. Is it a playoff game? What are your long-term goals? It's all about balancing that risk and reward.
So, the next time you feel that twinge or you're coming back from an injury, don't just ask, does it hurt? Instead, try to think through this whole process, really understanding your body, your sport, and your goals. That is the absolute key to a long and healthy athletic life. So, is your elbow ready for the next game? Now you have the tools to really decide.